Hello, I'm Dr. Brandt Gibson. I'm going to get a little vulnerable with you today. Don't have the screen behind me. I'm not going to use it because I really want to talk about this just straight to you and look you in the face and tell you what's going on. Because there's a situation. I have a patient that is struggling with his peripheral neuropathy, and he's got some of the things. Many of the things that we're doing is improving his situation, but he has a neuropathy that seemed to present after having hip surgery, and it became a big deal. And so I decided I was going to do some research for him. And what I found from a study that was done in 2014, and I'm sorry I didn't find it sooner. I'm surprised that I haven't seen this in all this research that I've done. But Mayo Clinic ran a study that found nerve damage after hip surgery. And people are going, oh yeah, a lot of times when you're doing surgeries, you can do nerve damage and you can cause peripheral neuropathy from that nerve damage. This is a different kind of nerve damage. This is a nerve damage that doesn't present right after surgery. It's often several weeks after the fact. It could be a month later or so forth. And the symptoms present because of the inflammation that was happening from the surgery. So basically what you're saying is, okay, you can get a nerve damage from surgery, which becomes a traumatic peripheral neuropathy. Traumatic peripheral neuropathy, you've actually directly damaged the nerve, either through suturing in the area, through pressure, through transection. All of those can actually cause a peripheral neuropathy, and it's a traumatic neuropathy and it's treated differently. Number two can be an inflammatory neuropathy. Now, the interesting thing is most individuals that get this inflammatory type neuropathy will not have inflammation years later when they still have the neuropathy. And why is that? Because it's not an inflammatory neuropathy per se. It's not the inflammation that you need to resolve to actually fix this problem. It's actually the inflammation right after surgery that causes the immune system to attack the nerve. That inflammation ultimately becomes an autoimmune type peripheral neuropathy. So the autoimmune neuropathy actually affects the nerves and fights off the nerves and causes nerve damage. And this nerve damage is a big deal. So you're going to do studies and say, yeah, the studies are showing that I have peripheral neuropathy. But what they're not showing is a good reason why. So a lot of times you may do vitamin tests, you may do a lot of different things, and you'll find that this type of peripheral neuropathy, because it's a autoimmune neuropathy that was caused by an inflammation that happened from surgery, needs to be treated. Truthfully, it can be prevented if it's treated right after surgery or soon after surgery. If they notice that they're actually treating it aggressively, they can prevent the nerve damage. If the nerve damage has already happened, what are your options? And in the studies, actually, they didn't give any real good options. There are options where you need to catch this right after surgery. If you start to notice they're getting some neuropathy type symptoms, you need to treat the nerves at that time. Now, because of that finding, because of what we're finding in that situation, any surgery can present with a similar autoimmune peripheral neuropathy from the inflammation from surgery. So if you're having nerve symptoms from surgery that just aren't going away, it's the inflammation, the autoimmune reaction to the inflammation that's actually causing the problem. So how do we treat an autoimmune peripheral neuropathy? You can treat it like a true autoimmune disease with IgG infusions. But in this type, a lot of times you can actually focus really aggressively on the nutrition side. And so what I'm going to talk to you about is something that's different, that's new, that's not exactly how I would typically go about this, but this is a unique situation. This is a unique type of peripheral neuropathy. And you're going to go very, very strict and slowly bring things back. Basically, what you're going to do is you're going to say, okay, I'm going to treat this by allowing the system to improve. One of the ways you can do that, I have a program that you can actually get into called 7 Systems Plan by Dr. Pat Luce that does a phenomenal job of improving your overall health of your systems, and it will help the body repair autoimmune disease. If you're saying, okay, I just want to do this more myself, what can I do naturally just to do it myself without having to go into any special program or anything like that? Well, then what you're going to do is you're going to do a very, very strict diet where you're going to eliminate a lot of different things. You're going to basically say, okay, I'm going to go through and I'm going to eliminate dairy. I'm going to eliminate all gluten containing products. I'm going to eliminate many of the carbohydrate type things, you can say, okay, I'm going to start out with very plain, simple foods, and I'm going to slowly add these things back that your body could be allergic to or your body could react to until it's fixed. Now, in saying that, we're eliminating gluten without you having any proven gluten intolerance, because what that does, that removes one of the stressors that will allow the body to focus on healing that nerve. We're removing dairy without any lactose intolerance because we're removing one of those big stressors. So we're removing any of these inflammatory type foods. We're removing any of these common foods that people are allergic to, not because we expect you to be, but you're saying, okay, I'm not doing any nuts, I'm not doing any gluten, I'm not doing any dairy. I'm really focusing on fluids, vegetables, and fruits, and we're slowly adding things back. So you basically say, I'm going to go for a period of time, I'm going to add gluten back in, but only gluten, not dairy and nuts, for example. And you just do this process and you allow the body to detoxify and so forth. An easier way, a better way is ultimately to go to the 7 systems plan, just because if you go through that process, then you have a long-term solution that can help you resolve everything and allow you to eat some of the ways you want it, things you want to eat without causing the problems. This is Dr. Brandt Gibson, and I'm talking to you today about a new finding that I found, it's been around, of a autoimmune peripheral neuropathy caused by surgery, in this case, hip surgery, where it started out as an inflammatory peripheral neuropathy, it became an autoimmune peripheral neuropathy that can be treated, but the treatment is going to be a very aggressive nutrition method, and that seems to be the most effective. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 332. Thank you, and have a great rest of your night.